Hi, this is Wendy Harold. I'm Deputy Director at the Division of Mental Health and Addiction. I'm the Deputy Director over the DARMA application. DARMA is the application that we collect data in for our federal reporting and for a variety of our specialized programs, including Recovery Works. What I'd like to do today is quickly go over the state fiscal year changes that we are going to deploy into production on October 1st. Usually we deploy changes July 1st, but there was some significant differences with this year's changes, so we gave providers a little bit more time to implement them. On your screen, you're going to see here that I'm in the QA environment, and you can know that by the PZ-QA. The QA environment is our testing environment. All the data in it is test data. It's a good training environment. If you have a large staff and you need to do a training, you can talk to us about getting you access to it. In addition, while I'm at this page, I want to mention that we have the different ways that you can connect to DARMA support. You can either go to the help desk, and that's the ticket tracking. That's the best way to track your requests. There is also an email and a phone number. So there's a variety of ways to access help. So I'm going to go ahead and log in. And I've already added client. So I'm going to look for them. Okay. So as I mentioned, I'm just going to be going over the state fiscal year changes. We are going to be doing a training similar to this that will go over all the data so that your staff are familiar with what we collect, why we collect it, and how often they need to report it. So on the consumer page, the only thing that's changed is we removed the CSDS ID, which was an old identifier that we had in our system. And then we also removed zip code. Zip code you will now find on the episode page. So I will go there now. So you find zip code right here. So starting on October 1st, I'm going to kind of go through today what you would be required to fill out in order to check the button or check the box for Recovery Works and send over the data to the WIT system. So we're expecting that you would do a consumer, which is the client view. This episode record, all the data here is contained within the start date and the end date of the episode. You can also think of episode as the admission date and the discharge date from services. So I'm going to go ahead, and the next thing that you would do, so you've done consumer and episode, the next thing you would do is go over to assessment. You do the ANSA. The only thing that's changed with the ANSA is there was an additional evidence-based practice that we were collecting here for SMI carve-out. So it was a specific program that DMHA was paying for. And we removed that because that program is no longer here. So you won't see any changes to the actual ANSA itself and the questions that they ask. It's just one less question here. So you usually don't do encounters in DARMA because you're putting your services into WITS. You're usually doing NOMS and diagnosis, but instead you're going to go over here to the SUD treatment page. So this is the new thing that we've created. So you're going to say new admission. This person started services on July 8th, 2019. And these are the service settings. So this is the most significant thing to this particular record. Why? Because we want to know what is the most intensive level of service that you're offering, and you're admitting that person into that. So if you have residential and that's what the person's going into, it would be residential even if they're going to your IoT program. So we want whatever's the most intensive. So most of you have intensive outpatient programs, so I'm going to go ahead and say that. I'm going to choose the location that they're getting this service at. Mostly, if you have two different services they're going to get it at, you can pick the one that they're going to get most of their services at. Then you put whatever diagnoses are appropriate. So this particular person has opiate use disorder, moderate or severe. You're able to put 5 diagnoses. They're ICD-10 or DSM-5 diagnoses. And you can have mental health or substance use disorder diagnoses here. They can be in any order that's relevant. Typically, your primary diagnosis is the main one that you guys are working on. That could be mental health if your organization also does mental health and you want to list that first. However, you do have to have a substance use disorder in this record in order to be able to submit it. So the next thing is the substances. So we ask for primary, secondary, and tertiary. So they need at least a primary drug. That's the substance you would be working on their treatment for. So this person takes other opiates, synthetics, and they do it orally. And if I had said, for whatever reason, if I'd said injection, there's another question I wanted to tell you about some validation that we have. If you say injection, we will not let you say no, the consumer has not used a needle. You'll have to say yes, they've used a needle and shared, or yes, they've used a needle. But I said oral, and that's correct, so I'm going to go on. But the next thing I want to mention is frequency. So this is the frequency that the person is taking this particular substance. One of the things that I've been talking to providers about is the fact that many of the records that I see in DARMA say none in the past month. And there are reasons for that. People are in jail, prison, in other environments that they don't have access to the substance that they have issues with. But I think it's also that the intake person, or when they first come in, they say, no, I'm not taking any substances. You do a drug test and you find out, oh, that's not the case. You have 30 days to update this entire record. And the idea is if you do a drug screening and you find out that they are taking a substance and you talk to them and you find out, oh no, they're taking whatever substance daily, then you can update this information so it's more accurate and will show progress, because none is the best, none in the past month is the best that you can have in this category. So I'm going to say daily for the opiates, and they started when they were 40, and they also take alcohol orally. They do it 1 to 2 times a week, and they started when they were 14. They don't have a tertiary substance, so I can leave that blank. Medication-assisted treatment. Now, this is specific to opiates. I know there's medication-assisted assistance for other substances, but we're specifically saying opiates here, because if I say yes, I'm going to have the drop down of the drugs that I can take. So if they're not starting on yes, this would be another thing that you could update. When they first come in, you fill up this record, and then you find out, oh, well, we're going to go ahead and put them on medication-assisted treatment. Then you can change it to yes, put the substance that you're going to prescribe to them, and then that yes, the prescriber is at your organization. And then these are the specialized treatments. Most of you are going to say none for this. SOGS is a gambling assessment. If you don't do it, you don't have it, you can say none. The health conditions, by the way, you're going to see these questions. The only new questions on this page are these right here. These 5 health conditions: hepatitis A, B, and C, TB, and HIV. The reason we added that this year is because federally, there's been a request that substance use providers look at these issues, help work with providers to look at risks and educate them about these conditions so that people can avoid getting them or can treat them if they have them. So smoking is here. We're going to add smoking and tobacco products. So we have a list that'll be in the manual of what tobacco products include. So this is where you would put this information. So I'm going to go ahead and fill the rest of this out real quick. As I mentioned, none of this information is new, so you'll be familiar with the national outcome measures here. So SAMHSA, our national organization, wants to know about education level of the person. They want to know if they're a child, if they're going to school. They want to know about their employment status. These are not applicable because the way that I'm answering the questions. If I said that they were unemployed, not in the labor force, then I would have to answer this question: why are they not in the labor force? And the rules as a child, so that's not applicable for us. But living arrangement is, so they're independent living. Social support is like NA or AA. And right now, this is the first time they're in treatment, so they're not attending any right now. They haven't used a needle. They haven't had any criminal involvement, and it's a male, so I don't have to answer the pregnancy question. So I'm going to go ahead and insert this. As I mentioned, now I would have all the data that I would need. So I did consumer, episode, assessment, and SUD treatment. And now I'm able to go back to the consumer and, like you would normally do, and edit it and send over the data to WITS. But I'm not going to do that. This is QA, but I am going to show you how to discharge this record and to admit them into another level of care. So I select this. So this shows the admission date, what setting is the most intensive that I have them in right now, and then the discharge date and discharge reason, which is blank because I haven't discharged it. So I'm going to go ahead and do that now. So they started 7/8. I went ahead and discharged them 8/15/2019. So if I were done treating this person, I could say treatment is completed. Or if they dropped out, they dropped out, or if I administratively discharged them. Most likely, your most common choices that you'll choose here are treatment is completed, they dropped out, or I transferred them to another treatment program or facility, including my own. So I mentioned that they're in intensive outpatient services right now. I'm going to go ahead and show you that I could roll them into my non-intensive program, which is a typical kind of thing. They go through an intensive program, and then you have an aftercare program that they come to a couple times a week. So now, after a month, they're working a little bit. These are, again, not applicable. They're independent living. Now they're going to social support. They haven't been criminally involved. And this is where I can say that now they haven't had any in the past month because it's been over a month since they've been in treatment, and we've been checking them and they haven't had any substances. So, and maybe this is 1 to 3 times in the past month. You know, I don't know. But whatever the case is, then that's what you put. So I'm going to go ahead and say that. And then I can go into admission or just click close and go into a new admission. I'm going to go ahead and, like I said, enroll them in my non-intensive outpatient program. And then this record, I wouldn't mess with it until they were discharged from my program, because unless I put them in a more intensive program, which I'm sure occasionally happens. Okay. Okay. And then I think that's all we had last time. And then other opiates. So they still have those substances that they've taken again, but they haven't taken them in the past month. And then he did this at 40. And alcohol. And it was 14. So most of this information, let's say now we have them on MAT. If they while they were not in IoT, maybe we got them on some kind of product. So I'm going to say that. I'm going to put none here. Again, the health conditions would be probably the same as they were. And most of the national outcome measures will also be that way. So once you've filled these out, you'll have the information. So he's working a little bit more. And then I insert it. So like I said, you'll be mostly working in WITS. Here's your admission record here. And so until you stop treating this person, you could keep them in this level of care. If you do treat somebody for only mental health, I think there might be some Recovery Works organizations that might be only doing mental health. If you are, you can go ahead and do the NOMS record and the diagnosis record that you're familiar with. The only change to those are, let's see, it's a little bit slow, is that NOMS looks a little bit different. We removed 5 questions, so it's a little bit shorter. Other than that, it's the same. And then diagnosis, the only change that we made is that you don't have the agreement type for CA or chronically addicted. So looks like we're having a problem with my connection. So just one second. It might, okay. Let's go to diagnosis agreement. There we go. And as I mentioned, CA agreement type or chronically addicted is not an option here anymore. So, but as I mentioned, you do not need to do the NOMS and the diagnosis agreement in order to do, if you're just doing substance use disorder treatment, you're only having to fill out this one admission record for each. If you're only doing intensive outpatient for the person, that's all you're doing, or they started in non-intensive outpatient programming, and that's what you keep them in, you're just going to have one level of care that you tell us about. So similar information, but organized a little bit of a different way. As I mentioned, if you need training for your organization, let us know. We're also working on a user manual so that it's a little bit easier because we didn't have that before. In addition, if you want to import, if you have electronic health record and you have this information in your system and you want to import it so you don't have to data enter it twice, we can talk to you about that. So we have a process. We also have web services available. So we have a couple different ways. So please let us know if we can help you. As I mentioned, these records here can be edited for 30 days and then they are set. But that is a quick overview of the state fiscal year changes. Thank